Madam Chair,
Very good, thank you. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, city council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligencer prior to the hearings and can also be found on phlcouncil.com. I now know that the hour has come. Madam Clerk, will you please call the roll to take attendance? Members that are in attendance will please indicate that you are present when your name is called, and also please say a few brief words when responding so that your image will be displayed on screen when you speak. Madam Clerk?
Councilmember Heenan. Councilmember O.
Good afternoon, Chairwoman, I am here, and my colleagues, I am here as well.
Good afternoon.
All right.
Councilmember Gim.
Good afternoon, colleagues. I am present.
Councilmember Green.
Madam Chair and members of the committee, I'm here and present, looking forward for today's conversation.
Good afternoon.
Councilmember Thomas.
Good afternoon, Madam Chair. Good afternoon, colleagues. I'm present.
Thank you.
Councilmember Brooks. And Chair Bass.
Thank you. And I think Council members Heenan and Brooks are trying to get on. They may be having some connectivity issues. I know that Councilman Heenan is just reached out and is trying to connect. Here's Councilwoman Brooks. I think she was having some difficulty as well. So let us proceed. Thank you. A quorum of the committee is present, and this hearing is now called to order. This is the public hearing of the Committee on Public Health and Human Services regarding Bill number 210082. Clerk, will you please read the title of the bill being considered today?
Amending Title 17 of the Philadelphia Code entitled Contracts and Procurement by amending Chapter 17-1400 entitled Non-Competitively Bid Contracts, Financial Assistance, to provide procedures applicable to the awarding of contracts to non-city providers of vaccine doses for COVID-19 and related variants, all under certain terms and conditions.
Thank you. Before we begin to hear testimony from the witnesses we have for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments they have for the witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. Madam Clerk, will you please call the first witness we have to testify this afternoon?
Dr. Thomas Farley, Health Commissioner of the Department of Public Health.
Good afternoon, Councilmember Bass and members of the Council Committee on Public Health and Human Services. My name is Dr. Thomas Farley, and I'm the Health Commissioner for the City of Philadelphia. I appreciate the opportunity to provide testimony regarding Bill 210082. This bill would put certain requirements on new contracts that the city issues for providing COVID-19 vaccination services and require reporting of data to the council regarding COVID-19 vaccination by providers. With the amendments that I understand are being proposed, we support this legislation. We're making progress in offering vaccine against COVID-19 to Philadelphia residents. Vaccines are being administered by hospitals, federally qualified health centers, a growing number of pharmacies, both chain and independent, health department managed sites, and the Black Doctors COVID-19 Consortium. Also, arrangements are being made to pair employers of frontline essential workers with providers to vaccinate their workers, such as the Children's Hospital of Philadelphia vaccinating teachers, school support staff, and childcare workers. With increased doses arriving in Philadelphia, at this point, most providers currently enrolled in vaccine administration are receiving as many doses as they can administer. Last week, approximately 47,500 doses were administered, a new high, an increase from 35,500 doses administered the week before. We expect that in future weeks, Philadelphia will receive increased doses from the federal government, and that the number of doses administered will increase by a combination of increased number of vaccinations administered by current providers, more providers, mainly pharmacies, becoming enrolled to receive and administer vaccine, additional mass clinics operated by hospitals, by the health department, by the city and the federal government jointly, and by community-based providers, additional providers receiving funding under a request for proposals to operate mass clinics and/or vaccinate hard-to-reach populations. This RFP was released last week, and as of yesterday afternoon, we had received 7 proposals. While demand for vaccination greatly exceeds the supply, people who meet eligibility criteria will be directed to their vaccination opportunities either by invitation by the vaccine providers or by invitation by the health department, using names from people who are registered on our vaccine interest database. People who live in under-vaccinated zip codes will be disproportionately directed to vaccination opportunities. Later, as supply catches up with demand, we anticipate the vaccination opportunities will be posted for everyone eligible to access. We understand that the Council is as interested as we are in a successful vaccination program. That is, one that meets our 3 goals of vaccinating people quickly, setting priority on vaccinating those people whose vaccination will save the most lives, and achieving racial equity with vaccination. To that end, the legislation lays out requirements regarding contracts that the city enters into for COVID-19 vaccination services. This legislation also requires that our department submit data to the Council on each provider's vaccine administrations, broken down by race, ethnicity, gender, and age range. We can certainly make that information available to the City Council biweekly as required by the legislation. Thank you very much for the opportunity to testify. I'll be happy to answer any of your questions.
Thank you very much for your testimony. I didn't have any questions, but I did want to go over a summary of the bill, just for the sake of clarity, so that folks viewing would have an idea of what this bill will actually do. The bill has 2 components, and it would apply to the following contracts under contract requirements. It will require any future contract between the city and a non-city entity that enables the city to administer COVID-19 vaccinations. Any future contract between the city and an intermediary entity authorizing that entity to in turn enter into contracts with providers of vaccine. This is the approach that the city decided to take when it contracted with PMHCC to manage an RFP process for selecting organizations to administer vaccines. Selected organizations will contract with PMHCC, not the city. Whenever an intermediary entity enters into a contract with a direct provider of vaccines, that contract would also be covered under this bill. For these contracts, the bill would require the following. The proposed contract must specify the terms and conditions under which the vaccines are being provided. The proposed contract must state explicitly that it is subject to the requirements of the code with respect to economic opportunity plans. The contract cannot be awarded unless the city has, 1, specified the amount and type of experience that the entity administering doses must demonstrate to be eligible for the contract. 2, evaluated an applicant's responsiveness. And 3, expressly determine in writing that the selected applicant has the necessary experience. Council must also be notified of any such contract not later than 2 days after it is entered into. The notice must describe the principal terms of the contract, including the experience of the entity that will administer the vaccine doses and the demographic information that the entity will collect. The bill as introduced tried to maintain that whenever the city provides vaccines to an organization, there is a contract between the city and that organization. The law department advised, however, that merely because a city is providing vaccines to an organization, A contract does not automatically exist. Rather, it is up to the executive branch to decide whether to enter into a formal contract with the provider. The bill has been amended to reflect the law department's conclusion. Most providers of vaccines do not have contracts with the city, in large part because they receive no payment from the city. Therefore, this portion of the bill will only apply to providers that in the future enter into contracts with either the city or an intermediary. That is why the second part of the bill, the reporting requirement, is so important. Also, it should be noted that all providers must enter into a detailed agreement with the CDC in order to be eligible to receive and administer vaccines. The reporting requirement is as follows. The health department or other official chosen by the mayor will be required to submit to the president and chief clerk of council and post on the city's website the following information every 2 weeks for every entity to which vaccines have been distributed. The name of the entity, the number of doses provided to the entity, the number of doses distributed by the entity, the race, ethnicity, and gender of the recipients of vaccines, the age range, and that will be under 20, 20 to 44, 45 to 64, and 65 to 75, and 75 and older of the recipient of the vaccine. So the age range of the recipient of the vaccine. This reporting requirement places no additional burden on the providers of vaccines and should in no way delay the administering of vaccines. Here is why. The CDC already requires that each provider of vaccines submit this demographic information to the relevant public health authority within 24 hours of administering a dose of the COVID-19 vaccine. The bill requires the administration, not the providers, to compile and present this data in a way that will enable the public to know who the providers are, how many doses they are receiving and distributing, and key demographic information about whom they are serving. This information responds directly to the desire for equity in the distribution of COVID-19 vaccines. And that being said, I just want to check in with my colleagues. I see Councilwoman Gim has a question. Councilwoman Gim?
Thank you very much, Madam Chair, and thank you very much, Commissioner Farley. Could you just speak a little bit, since you're here, about the FEMA site that was announced today, and that is to be some sort of a vaccination clinic? And could you talk a little bit about how that will be used and how it fits some of the, how you're tracking, the equity issues I think that have been raised through this bill?
Yeah, thank you. So we have been in discussions with FEMA for some time about a site like this. The federal government has laid out different types of mass vaccination sites that it may support and different types of support for those different types. This is what's labeled a type 1 site, with a type 1 site is meant to vaccinate 6,000 people per day. And the personnel that run the operation are predominantly the federal employees, with the locality providing, support with the facility, with some of the logistics around getting the vaccine there, and with scheduling of appointments. But the vaccine that is actually used is provided by the federal government. So we are very enthusiastic about this site. We work with the FEMA on choosing the convention center for the site. The tentative start date is March 3rd, and there's much yet to be worked out. But we consider it a great adjunct to all the other vaccination services we're providing in the city and that we'll continue to provide. So a lot of details yet to be worked out, but as far as one piece of this much larger approach, it's a great addition to the city.
And because FEMA is the actual dose distributor, is that correct?
Well, the federal government, it may be other federal agencies that are involved.
And so they'll be able to track the data and then they'll be delivering it to the health department. Is that correct?
They will enter data into our database, which is how we track all the vaccinations in the city. So we would get the same data from them that we would any other provider in the city.
Okay. And then, and is it your understanding that the site at the convention center will solely serve Pennsylvanians, Philadelphians, or could it be more regional?
It's a little unclear now. The first time we asked that question, they said that this was really a city resource, but with it being federal government, I could see there might be interest of people in the suburbs beyond us. So I would say that's not, I don't have a definite answer on that yet.
Okay. And then, but either way, they will provide to the health department site-specific information. Is that correct?
I'm not sure what you mean by site-specific.
Well, out of the convention center, you will know out of the convention center site the demographics of those who are served.
Absolutely. Yes.
Okay. One of the questions I have is whether you are tracking zip codes. And, similarly, one of the reasons why I ask is that this is something that I think, like today's big Vaxathon at the Leah Corus Center, is really trying to focus in on the hardest hit zip codes in Philadelphia. And it helps to ensure, for example, that we're actually covering Philadelphians. I know one of the concerns we had around Philly fighting COVID was that they didn't just do Philadelphians. I mean, there were plenty of individuals who came from outside of Philadelphia, et cetera, et cetera. So are you tracking zip codes?
Yeah, so we have done we do get zip codes in our database when they come in, and we've done an analysis of the zip codes of the recipients. And as you're probably not going to be surprised to learn that the, the zip codes that have fewer vaccinations tend to be low-income minority neighborhoods. And so we're first of all, we posted that map on the website as of yesterday. We used to have a map there by zip code of provider. Now it's by the zip code of the residence of the recipient. And we're using that to invite people to future vaccination opportunities, where we're oversampling people who live in those zip codes that are under-vaccinated.
And is that information that you can send over in your weekly distribution to council? I know the bill does not cover zip codes. It just covers race, age, gender, but it doesn't cover zip codes. But if you have that information, is that something that you could commit to sending over to council in a weekly way?
We can provide some
whenever you're reporting it over to council.
It could be an overwhelming amount of information unless we figure out how to narrow it, because I don't know how many zip codes there are, 40, and then there's many different providers. But the zip code information itself, I have no problem with getting that over there.
Okay. Yeah, I think we're trying to track, we're just trying to make sure that providers as well as our city, we're just keeping track of the vaccines in Philadelphia. It sounds like you are, though, already, and that we're particularly attentive, as you said, to zip codes that are deeply underrepresented. So
yes.
I think it's helpful to hear. But I think with certain sites, we just want to, and we're going to be vaccinating a number of teachers, some of whom, and other school staff, some of whom are police officers and other individuals who may not actually live in Philadelphia. So it just feels very attentive for us to pay attention about the represented zip codes within our city. So as long as you're doing that, and, I don't expect to be overwhelmed, but we're mostly just tracking high-risk neighborhoods and communities. So if we could just be able to be in communication on that with you, I think that would be helpful.
Yes.
I think those are my questions, and then I could ask a few more if I have any others that come up. Thank you.
Thank you, Councilwoman. I see that Eva Gladstein has raised her hand. Eva, if you have a quick point, and Councilwoman Sanchez had a question.
Yes, I just wanted to share that I posted in the chat the data that the health department released just this week. It includes a map that shows the density of individuals who have been vaccinated by zip code. And this is the kind of information that will be updated.
Thank you. Thank you very much. Chair recognizes Councilwoman Sanchez.
Could I have a point of clarification, Madam Chair?
Sure. Sure, go ahead.
So my only clarification for Deputy Mayor Gladstein, I think what we're trying to figure out is by provider as well, so that we understand by provider and zip code. I don't know if that map tells that information.
It doesn't, and I think going back to Dr. Farley's point, we'll have to figure out a way to show it to you by provider in a way that isn't a humongous Excel spreadsheet, but we can do that.
Understood. Thank you.
Okay. Yeah, thank you. Thank you, Councilwoman. Councilwoman Sanchez?
Thank you. Thank you, Dr. Farley. And I want to recognize by the speed by the last couple of weeks that stuff is getting out and information. And I realize it's hard to say we can put one master list together, but can you speak to me about how are we communicating with folks, particularly language minority folks, about the fact that we have them on the list and that they will be called? We're getting a lot of calls around, and I've said this a couple of times. I have my parents in 8 lists. They finally got their first shot, knock on wood. So how do we communicate with those folks to say, wait, the max vaccination site, for instance, in my case, in the community academy, are those folks going to be robocall? Speak to me a little bit around that.
Yeah, so we have people in our database, and then as these opportunities arise, and there are different sorts of opportunities, we direct people to them. So, for example, everybody in the database over the age of 75 within the last week was invited to set an appointment at a pharmacy, and that was 29,000 people. Then,
so was that via robocall? Was that a letter?
It was all the above. It was email, robocall, or personal call if there's I'm taking it back. It's email or robocall. Yes.
Okay, so is there a way, again, not everybody has email, robocalls. My mother got a robocall and she said, somebody robocalled me. And of course, I didn't know what it said. Is there any way we can, because this is going to take a while, and the transition between the volume between 1B and 1C is going to be so drastic. Is there any way that we can send out a postcard? This is a number you call in English or in Spanish. I know you guys were talking about setting up hotline numbers. Again, just trying to some people have not been communicated at all as you're trying to do this spreading out. And so, or are you just suggesting people call 311 and find out where they fall?
We'll see what kind of additional outgoing calls we can do. Our call centers are frankly overwhelmed right now. And so we're trying to do as much automated as possible while recognizing that some people do need that kind of additional services. Last I checked, I think about 95% of the people in our database, including a very high percentage of the elderly people, did have an email address. And so we're definitely getting phone calls in. We'll see what kind of personal calls we can do. And as far as language access, I can say this: it should be in the next day or so. If it's not already there, our vaccine interest database will be in different languages on the website, 5 languages. As we direct people to vaccination sites, we're also looking at and building partnerships where, in some cases, other call centers may be calling people. So, for example, the Einstein is doing a mass clinic at Enon Church. We gave them a certain number of people who met eligibility criteria. Their call center is actually going to call them and schedule the appointments. We are looking at other opportunities like that, including that some of the health plans who have volunteered to use their call centers to do outgoing calls and schedule appointments. There's a lot of technical aspects of that to be worked out, but we're looking for more opportunities like that. Okay. And I should say, we also, for the many people who have not yet been offered an opportunity for an appointment, we're going to be sending out messages that just say, we got you. We know you're here. We know you haven't been invited yet. We'll get to you as soon as we can, so that they know we haven't forgotten about them.
As it relates to this particular bill around the transparency, how long before you feel you're going to have a kind of a public dashboard that really allows people to see the distributions by zip code? I know right now we're just playing catch up, 20% African American. I know that from 8%, that's a lot. How do we ensure proportionately moving forward that we're going to play catch up, right? You know, if in a month from now, what's the goal? A month from now for us to be at 50-50, what are we doing to make sure we get there as we get more vaccines in the pipeline?
All right, so we have a dashboard on the website right now. It does have, you see those numbers, and as of yesterday, now we have the zip code map. That will continue to be updated. In addition, the bill requires much more detailed data by the provider level. We think we can get that to council next week. It's a lot of information. I don't know that we can put that on a website in a way that would be interpretable by people. So it may take us longer to figure out how to put that kind of thing on the website in a way that people aren't just overwhelmed by it. As far as the targets go, I mean, certainly I'm hopeful that we've offered vaccine to everyone in the city who wants it by end of July. That's what the president said. We should have enough doses of vaccine for every American by the end of July. I hope we can deliver it by then. So by then, I hope that we've absolutely achieved racial equity so that every group, as I would love to have 100% of people in the city of every racial group vaccinated. If, say, 70% of people want vaccine, at least that we have a racial equity in that 70%. It's going to take us a while to get from here to there. So for 20% now, I haven't laid out an intermediate target, but I would, African Americans are about 40 to 45% of the city. We want to be rising from that 20% towards that 45% in the next, whatever it is, 2-3 months.
But I think, and that's why the dashboard becomes important, because where you assign the vaccines over the next 3 weeks is either going to put you on track or not, right? So what we don't want to have is a month from now, we're like, oh, well, we're at 25% because we're only giving out 40% when we know we got to give out 60% to get to that. So I think that's important. Thank you, Madam Chair. Thank you. And again, I'm seeing the progress. We want to be helpful in council in terms of messaging. So any additional messaging, robocalling that you think our offices could do to add to that, we really want to be part of that. Thank you. Thank you,
if I could add, so we have, there are some providers that really do an excellent job of reaching diverse people for vaccination. There's other providers that can do a very high volume. And we're sort of working with both and trying to figure out how to balance this out. The federally qualified health centers are doing a fabulous job of reaching people who are the most important to us. They're not doing very high volume right now. It's a different sort of model. The pharmacies can do lots of volume, but they tend to reach a much narrower demographic, more white people. So you'll see that when you also see the data. We're trying to push as many as possible to the providers that reach that more diverse demographic.
So the pharmacy, I know that there was some database issues around the independent pharmacies having access. Was that glitch and that stuff straightened out? Because I know that was limiting some of the smaller pharmacies to being able to participate.
Yeah, so that there's a fair number of pharmacies, 37, that have begun the process to enroll as providers. They have to go through multiple steps. We have, I don't have the exact number, like 7 or 8 that are enrolled. I think only one of them has received vaccine. Others were supposed to be receiving vaccine this week, but because of the snow, it probably won't be until next week. So we're working hard to help the other ones get enrolled. And they will help. I do think the independent pharmacies will tend to reach a more diverse demographic.
Thank you. Thank you, Madam Chair.
Thank you, Councilwoman. Excellent questions. I do want to recognize that we've been joined by Councilman Heenan, and Councilman Dom has a question. Before we go to Councilman Dom, Eva Bastina had another point of information.
Thank you. I just wanted to add to what Dr. Farley said, is that when we make invitations to these clinics, we're over sampling from zip codes that have been under vaccinated. And so that's another way to work to achieve our goals.
3 weeks. I am not aware, has the mayor shared any plan with City Council for moving 6,000 people, plus the additional hundreds of healthcare personnel and FEMA personnel required to vaccinate them in and out of the Pennsylvania Convention Center on a daily basis. Yet in 10 days, March 3rd, we are being told we'll have the capacity to open a FEMA Type 1 mega site capable of vaccinating 6,000 people per day. And we will do this at a site that has sporadically vaccinated at the most 500 people per day since we started receiving vaccines. We have no parking plan to my knowledge. Has SEPTA shared with us a public transportation plan? City council members have seen no allocation plan at a site designated to distribute 6,000 vaccinations per day. And in the absence of any of these details, surrounding the announcement today, I'm just calling on the mayor and the administration to do what we've been asking them to do. Share with us the plan. Show us the plan. Show Philadelphia how this is going to work and why it makes more sense for the city to be at the convention center than Lincoln Financial Field, especially since City Council just passed a resolution yesterday, 16-1, recommending Lincoln Financial Field and other sites. So if you could share with us the plans for SEPTA, the parking plans, and some of the other questions I've asked.
Thank you, Council Member. Let me just say I have said before repeatedly that I think given the weather, given the location, that being outdoors at the link is not the place to be, the best place to be right now for a mass site. I think that an indoor location, the convention center, is a better choice. There's plans to be worked out, and many other city agencies involved, and others may be able to speak for those other city agencies. I'd certainly say we can make available what information we at the health department have.
What about the parking plan or SEPTA plan or any other questions I've asked?
Good afternoon, folks. Tumor Alexander, Managing Director. Council Member, those plans are all being discussed right now with FEMA, with the FEMA team, with our emergency management office. We're looking at a plan to provide discounted or somewhat free parking in the surrounding parking lots that surrounding the convention center. FEMA staff has been on the ground for the last week and a half, if not longer, working with the operations teams, not only from the city, but also from that facility. And SEPTA is also a part of that conversation. Certainly, we think this location is more accessible to folks via various methods of transportation, including several public transit options. Also, we think we think it's a good site. FEMA thought it was a good site, and we're working on a plan of making sure we surround that site. As it relates to the vaccine, I think you heard Dr. Farley talk a little bit earlier about this particular site will come with vaccine provided by the federal government. It'll be vaccine that they ship to us, but it's extra vaccine on top of our current allotment of vaccine.
So I was told by our congressional leaders that FEMA doesn't really pick the site. The sites are picked by cities. And I guess, Tumar, one of my questions would be, if 30 of the largest cities are using stadiums, what do we know to use a convention center over a stadium that they don't know?
I can tell you, I don't know in particular where stadiums are situated in other parts of the city. I know where the stadium is situated in this part of the city. Yes, it's accessible by the Broad Street line. Yes, a person, may have to walk at least 5 or 6 blocks, the equivalent of 5 or 6 blocks to get to that off of that line. We wanted a place that was accessible via car. We wanted a place that was accessible via foot. We wanted a place that was accessible via public transit in a convenient way. I know you mentioned that we've only been able to get the output of 500 or so and sometimes more dosages at the convention center. I think that was a direct correlation of the staffing and of the amount of vaccine we had. With coming along with FEMA staffing and FEMA support, we think we could do this. We think we could work with them and be able to get this 6,000 input a day. And we think it's an excellent site. We're also working with them and talking to them if there's a potential to put other type sites, FEMA supported type sites in and around the city. And certainly they want to use this model to do this around the region as well.
Do we have a parking plan right now and a plan from SEPTA, or is that something that has to be developed?
That's something we're continuing to work on. I think this site will likely, I'm not sure what the federal government said in the announcement today, but we're thinking that it's going to stand up at some point the beginning of March. So we're working on all of the details. Like I said, the FEMA team is already on the ground in Philadelphia has been working with our team and has been in that facility along with a bunch of other partners working through the operational plan.
And, Boston and New York are using stadiums, and I assume the weather there might be a little colder than Philadelphia, but they seem to be successful there using their stadiums. So I just want you to put that into the mix. The other question I had, though, is that do we have a way of tracking, from a registry standpoint, the vaccines so we can ensure that we're going to provide equity across the board?
I'll let Dr. Farley talk through how we'll be referring to folks from off our registration list for that facility.
So we can schedule people, or we can direct people to schedule appointments, over selecting in the under-vaccinated zip codes, and that's our intention here in the same way that we do right now for the other sites. And those under-vaccinated zip codes are more likely to be North Philly and just a little bit north of that, so pretty close to the convention center, a long way away from the link. We can do that. And then we will get the data from the site, so we'll see exactly who they are vaccinating.
And we talked to Dr. Stanford about her possibly handling this site, coordinating, because from all the people I've seen who are doing the vaccinations, I will tell you, I think she's doing one of the best jobs in the city.
I think Dr. Stanford is doing an excellent job. I think we need a diversity of providers, all sorts of providers in different settings, different parts of the city, reaching different demographics to get everybody vaccinated. So I think Dr. Stanford is doing exactly what she should do, but we need additional sites on top of that.
And have we picked other sites other than this, like the Mann Music Center or other church parking lots?
We have other sites for mass clinics that the health department is running, which we've announced. So we have, one in North Philly, West Philly, and then I guess sort of the very near Northeast. And we are looking at other sites that could be used by us or by partners or by additional things that might be in partnership with the federal government.
So let me just make sure I understand it. Are you saying you have set up an ability to register and schedule a software program where residents can register through the city and be notified through the city as to when they can come to the convention center in an equitable fashion?
Yes. Now it's going to involve, much to be worked out, but the process, similar to what we're doing right now, people who are in our vaccine interest database will be invited to schedule an appointment. So they'll need to take a step themselves to schedule an appointment. And then they get the appointment and then they come in and get vaccinated there. And we can oversample the under-vaccinated zip codes in who gets invited.
And I think one of my colleagues mentioned, I mentioned this yesterday, other stadiums are using zip code algorithms to schedule appointments. So do you have the ability with that system to focus on zip codes of the city?
Yes, we're doing that already. Absolutely.
All right, I'll come back. I don't want to take too much time. Thank you, Doctor. And thank you, Madam Chair.
Thank you, Yes, I see Jim Engler has his hand raised. Mr. Engler?
Thank you, Chairwoman. I just wanted to mention briefly, in a number of those cities that you mentioned, New York and Phoenix, they're also using convention centers in addition to their stadiums. So as we've discussed, we haven't foreclosed the opportunity to use stadium sites in the future or large outdoor sites in the future. But a number of those jurisdictions are using their large convention centers at the same time that they're using outdoor sites. So we're open to it. We want to have continued discussion and dialogue with you and with your colleagues, specifically the district members, about the siting of vaccination sites in their districts. But this is the first very, very large site that we've announced today, and we expect that there's going to be a lot of siting discussions to continue.
I just hope that people don't have to pay for parking to get a vaccine when we have a facility where they could go for free and not have to pay. So we have to figure that one out.
And I think we also want to make sure that there's equity in the accessibility of the site as well, right? If someone doesn't have access to a car to be able to drive there to the stadium complex, but they can more easily get to the convention center, we want to make sure that that's a priority. So there's a whole bunch of competing interests here, and we look forward to continuing to work with you and your colleagues as we build out this vaccination program.
But keep in mind, 82% of the people do have a car, and SEPT is willing to work with us, whether it was the Vaccine Express on the Broad Street line or with buses. So there was lots of opportunities there. And I will say that only New York, I'm aware, if you have the information, send it to me privately. New York has 2 stadiums, and they opened the convention center. Everyone else used their stadiums as the lead-in.
Sure, and those stadiums are located in different parts of the cities, so I don't want to belabor the conversation, but we look forward to continuing to work with you in the same way that we're working with SEPTA and our other transportation partners as we stand up this large site.
Okay, thank you very much, Madam Chair.
Thank you. And so, Jim, what I'm hearing is that you're saying that you all have not closed the door on the link idea, that's something that still may be a possibility, along with the convention center and along with sites in the neighborhood. Is that in the district council districts? Is that accurate?
Sure, Councilwoman. So what we said is that we think this is going to be an all hands on deck approach. We're going to need a multitude of avenues and providers to be able to deliver the vaccine. A lot of this is about priority and sequence. As we have amount of vaccine to deliver, as we have staff to deliver the vaccine, as we deal with the weather and the other impacts of our region as it comes to delivering vaccine. So all of that has to be sequenced. We had a major step today in the announcement of this Type 1 FEMA site at the Convention Center. We expect we're going to have more discussions with FEMA about other potential federally supported sites in the city, as well as other sites that providers that we work with now or will work with in the future will want to open that could potentially be outdoor large sites. So this is going to be a continued process over several months, and we want to work with all of you to make it the best program it can be.
Great. So again, what I'm saying here is, I want to make sure I'm hearing it right, is that you have not closed the door, that there is still an opportunity here. Correct?
We're going to work with a large number of providers and a large number of sites across the city.
Yes.
Well, I can't speak to I can't speak to one specific site or one.
I'm not speaking to one specific. No. I'm not speaking to one specific site. I'm just saying that you are open to considering that site, along with, as a district council person, I would like to see a site in my district, as all district council people would like to see. Yes, so we like the idea of the link. We like the idea in conjunction with the convention center. We like the idea mostly in conjunction with sites in the neighborhood for folks who don't, generally, a lot of people don't leave the neighborhood. So if we can have stuff in the neighborhood, I think that's a win-win-win. So I just wanted to make that point. So thank you very much.
Yes, ma'am.
Councilman Dom, were you done with your questions?
Yes, Madam Chair. Thank you very much. Thank you.
You're very welcome. I believe we had a question. Councilman Heenan?
Thank you, Madam Chair.
Yes.
Thank you, Madam Chair. Thank you, colleagues and administration for talking about this publicly. So I have a couple questions. First, I want to note, and as everybody know, I can be a little aggressive in fighting for Northeast Philly vaccination sites when the vaccine is available. I understand it's all about the supply, but in preparing for special FEMA type of sites like the announcement today is extremely encouraging. And I know you've been working on it for some time, because during the process over the past several weeks, and every time I called about when are we going to have the doses available? When are we going to have the vaccines available to Northeast Philadelphia and other parts of the city in more of a volume way? It's always been, we just got off the phone with the White House. We're talking to DC and the Commonwealth. So, I guess that anticipation is turned into excitement and then expectation. All right. So, and I know that's been a concern for the health department, is managing the expectations. But nonetheless, it seems like, those expectations are near, which I'm happy to report. And I'm going to continue to talk about Northeast Philly, and was happy it was mentioned today. The question on the FEMA sites, and I guess that's, subject to the feds and their ability to provide product. It's 6,000 a day. How long currently at the convention center? How many days do you anticipate this being? Is it you anticipate this being to herd immunity, or is it subject to availability? So how long will they be supplying 6,000 a day as a FEMA selected site?
Council member, there still many things to be worked out, but I think we're talking about a limited period of time when they'll have a federal team here deployed to do that. But whatever period of time they're willing to do that, we are happy to receive that.
Listen, you can get an amen out of me for that. And if FEMA decides to have other sites, even if it's at a lesser or more type of volume throughout the city, would you anticipate them also supplying the vaccine as well? Is this a snapshot of how FEMA sites are working?
Now, the basic model appears to be that a type 1 site from the federal government comes with its own vaccine, but the type 2 sites or smaller sites, the localities provide the vaccine. So I think that there may still be a role for type 2 or other sites with some level of federal support because we also need personnel and we need other forms of federal support. And because the number of doses that we are receiving has been increasing, I anticipate it will continue to increase. So the doses may not be the limiting factor, very soon, in which case then a site that provides where we have to use our own vaccine is still very valuable to us. So definitely those options are out there.
All right. And I think, this is certainly an extremely positive type of start in getting to herd immunity while we still try to identify other sites that will be a little bit more predictable, especially with, getting 31,000 doses locally, separate from FEMA. That being said, if we are on this path and this model, as you discuss or as you mentioned, maybe vaccine being widely available according to President Biden, by July, when do you think we can anticipate reaching that herd immunity goal, knowing that over 30% of even 1A healthcare workers, frontline workers, still don't feel comfortable for whatever reason, getting the shot in the arm for vaccine?
Yeah, so, national surveys show that about 65% of people say they want to get the vaccine. That number may be rising a little bit as people see other people getting vaccinated and doing fine. So I don't think we'll ever vaccinate 100% of adults in the city. I would be happy if we got above 70%. If we get above 70%, that'll make a big difference. It will not eradicate COVID from the city or from the nation or from the earth. So we're going to have to figure out how to live with this infection. And vaccination will be an ongoing thing that takes place for, probably years for people who are unvaccinated, or we may be updating the vaccines. So, people talk about herd immunity as if it's a yes/no thing. It's more of a gradual thing. The more percentage of people who have vaccinated, the better. And we're going to just continue to get as many people, give them that opportunity, encourage them to do so as we can.
And I don't, for clarity, I don't think it's I was not under the misunderstanding that it was a yes or no thing. It was a goal that we're trying to reach in a methodical and planned out way, so we can reopen our economy and we can, until we get used to living, coexisting with the virus. So I completely understand that. So, moving forward, as always, my office has received thousands and thousands of calls, and it's not an over exaggeration, because we forward everything over to the department expression of interest. So as we continue to move forward, we want to work and continue to work with the health department, as Council Member Sanchez had said, disseminating the information out and communication on education, educating our communities in the city at large. I'm going to speak on my district in Northeast Philly, specifically on why it's important and why it's safe and its efficacy to reach that goal of herd immunity. So please continue to share anything you can with my office and other council members, so we can break through some of those challenges that we have. And that's it's more of a statement and offering our assistance as always as we move forward. So, Madam Chair, thank you.
Thank you, Mr. Vice Chair. Chair recognizes Councilman Green for a question, followed by Councilman Thomas, and then Councilwoman Gim for a follow-up question.
Thank you, Madam Chair. Dr. Farley, I just have a few quick questions. With the convention center location, in my understanding, that's a type 1 location. Do we have an understanding of the number of vaccines that will come that's a separate than the city's allocation that will come for a type 1 location?
All the vaccine that would be delivered at that site would be provided separately by the federal government.
Right.
So it's 6,000 per day for however many days they're operating here. We don't know yet how many days they're going to be operating here.
Okay, so that'd be the 6,000 per day that you talked about earlier.
Yes.
Okay.
Yes.
And currently, I know from our earlier call, you talked about I think we're at about 31,000 vaccines per week.
That's 31,000 first doses per week, and then later they get matched by subsequents. Yeah.
So I guess the question, as you're rolling out the different locations, how are we messaging? And I wasn't really cognizant until this morning's call, the impact of the winter storm that we've had in the Southwest and how that may impact delivery of vaccines to the city of Philadelphia. So is there, are we thinking about ways of messaging that information to constituents as you continue to roll out these locations? Because that delay will impact the number of vaccines we're receiving on a weekly basis. And as people are going to different locations, like the Black Doctors COVID-19 Consortium had their 24-hour vaccination site today, that will cause some impact. And we're already in a challenging perspective in reference to people really trying to get the vaccine as early as possible. But we have a limited window. And I know I talked to you earlier about expanding some of the categories under 1B, but how we're trying to message that to constituents throughout the city of Philadelphia, that issues like the winter storm in the Southwest is going to impact our city from a vaccine perspective.
Yeah, so I'm actually hopeful that it will not have an impact on the individual resident of Philadelphia. What it means is that shipments that were scheduled to arrive this week, maybe Wednesday or Thursday, may arrive over the weekend, or they may arrive next week, so that a provider may get twice as much next week as he would have ordinarily gotten. And that would be a problem if they had essentially zero inventory, but most of our providers have an inventory, and so they can continue to vaccinate, and then there'll just be a delay, but then they'll be able to catch up when the additional doses come in. Now, it has caused problems for some of the new pharmacies that have come on board, and they were supposed to just get their first shipment this week, and so that'll delay when they will start vaccinating. But for the most part, I think that's a relatively small fraction of the total vaccinations that are being given out there.
Okay. And then also I know at the state level, they've had some issues in reference to the number of vaccines that are available. And that's not impacting us in the city of Philadelphia, from my understanding, because we receive vaccines directly from the federal government. But I'm not sure if people are cognizant of that information. So I'm not sure in any of your press conferences or other messaging, you're letting people know that those issues are not impacting us here in Philadelphia.
I think that question may have come up at the press conference today, but yeah, it may have a small impact on us if there's someone in the counties who can't get a second dose and he's requesting to come into the city to get a second dose. But we are monitoring our first dose, second dose pretty well, excuse me, and we're thinking we're not going to have that similar problem within the city.
Okay. And then the other question, and since you're here, I did not get a chance to answer this question earlier. My understanding that Johnson & Johnson is also going through the FDA process. How will their possible approval impact the number of vaccines we have here in the city of Philadelphia? And because I believe their efficacy through a one-dose vaccination will be different than Pfizer and Moderna, are we doing any type of information? Because I've already heard from some people that don't want to get the J&J vaccine because it does not have the same level of efficacy, even though it's a one-shot dose and you don't have the same logistical issues that you have with the Pfizer and Moderna vaccine.
Yeah, so our best estimate is that it will be approved and we'll start to get the first doses right around the 1st of March. So that's coming up pretty soon. But the initial shipment is going to be pretty small, and we don't know about subsequently, but I hear about production problems. So I'm expecting the number of doses we will get in the future will be fairly small. So we're going to have, I think, some in-depth conversations about how to use this vaccine, because the trade-off is exactly what you're talking about. Has a ease of being given in one dose rather than two. But if you look at just that measure of vaccine efficacy, it's not as high as Pfizer Moderna. Now, to a certain extent, it's apples and oranges because it was tested in a different population at a different time. So maybe it's as good, but many people would perceive it as being not quite as good. So we're going to have some discussions about who is interested in it, who is it appropriate to offer this to. We haven't solved that yet.
Mm-hmm. I'm just saying, trying to get proactive and getting ahead of the curve on some of these issues as we're thinking about this. It makes sense to start thinking about how we message this information, because I could see that being a challenge within citizens in the city of Philadelphia saying they don't want to get that vaccine, they want to wait for other vaccines, when even at a maybe not quite level of efficacy as the others, it's still going to protect you as something to stop COVID. To me, it reminds me of getting the first dose of a Moderna and Pfizer, but you didn't, for whatever reason, didn't get your second dose. It's still something that we need to message so that way we can get as many people vaccinated as possible with all the tools we have at our disposal, especially as we continue to ramp up and we're getting to a point, hopefully in late April, early May, where we'll be in a much better position in reference to vaccines and getting people to get vaccinated, because we won't have the same level of shortage.
Yes, I agree.
Okay. Thank you, Madam Chair.
Thank you, Councilman. Councilman Thomas, Isaiah Thomas.
Thank you, Madam Chair, and good afternoon, everybody. Thank you for taking the time to be here today. I just want to echo the sentiments of my colleagues as it relates to the concerns in the distribution of the vaccine. I have a number of elderly people in my family who signed up for the vaccine and haven't heard anything back. I'm also concerned about the communication to constituents, simply because, I don't, the phone calls, I don't know if that's what's happening. Everybody doesn't have email access. And then we also have some perception issues as well, too. So I just want to start by putting, all those concerns on the record. I know other people have stated it. I've heard some of the responses to some of those issues. But at the end of the day, we're going to get off this Zoom, and then this hearing is going to end. And a lot of us as council members are going to have to go back to constituents, and some of us even family members who've qualified for the vaccine for months now and just haven't heard anything back, and might not have the ability to wait in line for an hour and a half or 2 hours, which is the conditions that we're in right now. So I just, I hear that we're making some progress. But, I don't know. I think we have to have more of a sense of urgency. I'm not trying to judge anyone at all, but I'm looking at it through the lens of the average everyday citizen who, again, has signed up for some time and can't even get an answer from their elected officials as to what they should be doing or what steps they should be taking. So I did want to start by putting that out there. I don't know, Dr. Farley, if you wanted to respond to that, but that was it.
I'm very sympathetic. Lots of people in the city right now want to get the vaccine and can't get it. So it's not just your relatives, it's many, many people. And I wish we could get it to everybody right now. We haven't limited by doses. Now we're limited more by just how many providers we can have out there administering those doses per day. We are going to get to people. It's going to take a little time. We have said from the beginning, this is going to take months. But with the excitement of people seeing other people getting vaccinated, everybody feels a little cheated. And so I understand it's tough on you with all your constituents contacting you and all of the council members. But we will get to people. We are doing this as quickly as possible and as trying to be systematic about it to meet our goals. So we're doing the people who can save the most lives and do it with racial equity in the process.
No, I think that the problem for our end is that we can't comfortably communicate that to people because you know what those things are that you're doing. And unfortunately, we just don't know. So Councilmember Bass trying to, get someone on the record to say whether or not the stadium is still an option. Like that question never got answered. So we're having these hearings, we're having conversation, but often what ends up happening is we don't have tangible answers and information to take back to constituents and to different people when they ask us questions. It could be a family member, it could be a stranger. This is the cure. This is the thing that will make people's anxiety level drop significantly as it relates to individual battles with this coronavirus crisis. So I know you understand the sense of urgency. I'm not trying to say you don't. I just have to say that on behalf of the constituents and echo the sentiments of my colleagues there because it's a huge problem. Another issue around this idea of public perception, while we have a good amount of people who do want access to the vaccine, we also have a significant amount of constituents who, similar to what was just discussed before, are hesitant because They're hearing different variations of the vaccine. They don't know which one they'll get. Maybe they don't trust it at all. So what has been the communication strategy to address that issue particularly?
And so we're working at a couple of levels. We're working with, community organizations and community leaders, people who might be trusted messengers. We are also working on a mass media campaign that will be getting messages out about the safety of the vaccine. And then there was also our delivery, and that is not launched yet, in large part because we know many people can't get the vaccine. And so we didn't feel it was right to say, better get your vaccine, and then just frustrate people when they can't get it. But that should be launching. It's sometime in March. I forget exactly when. Hopefully in early March. But we're also, I earlier today quoted a survey that we saw that asked people who do you trust the most to give you advice about the safety of the vaccine that might persuade you to take the vaccine if you're uncertain. And I might have expected that people would pay attention to celebrities or community leaders, but what came out as number one was your own doctor. Your own nurses, the people that already know you. And so I'm very much interested in giving the vaccine to providers that already know these patients. And I think they can be persuasive to those folks. And so, the federally qualified health centers have been really trusted providers. They have a limited throughput, but I think if there's anyone who can persuade the reluctant people, they're the ones who can do that.
Thank you. I appreciate it. I actually think that that's a phenomenal idea. I think providers are an excellent source of trying to reach that demographic. And I can't wait until March to see what this comms plan is. And I'm hoping that with that comms plan, that means that we'll be in a position to provide mass vaccinations for the citizens of Philadelphia by mid-March. The last thing, the administration talked about using a convention center as it relates to a mass vaccination site. I know that they talked about subsidies as it relates to pay. I'm wondering if anybody talked to the PPA, the Parking Authority. Councilmember Dom talked about people not paying for parking and things like that. I haven't, and I'm the chair of Streets and Services. I haven't been, and hate to wear that hat right now, but I haven't been happy with the PPA and what they have done and how they've treated people during the pandemic. I don't feel like as a city we've been sensitive to the issues that people are facing from a fiscal perspective. And if we're looking at any center city location as it relates to a vaccination site, I'm wondering what dialogue has happened with them and what is their role going to be as it relates to supporting people coming into the convention center or any mass vaccination site in the city of Philadelphia.
I'll jump in, Tom, Dr. Farley. Council member, thank you for that. And I think we agree. We have been engaging with PPA as it relates to some of the mass vaccination sites. So certainly they'll be a part of the conversation around the convention center. I think Dr. Stanford, and when I saw her on the news earlier this morning, she mentioned that we worked with her and PPA to ease ticket restrictions around North Broad Street for her event. And we're looking to do that for other events when we do those sites. So PPA has committed to a willingness of not writing tickets or easing some of their enforcement as we could get them information around different vaccine sites and operations of those sites.
Point of information, can you go into a little further detail regarding PPA easing enforcement? Like what does that all entail?
That's woman. That just means they're on North Broad Street in and around the Leah Chorus. And I can't talk to you about the boundaries just off the top of my head. But that means specifically that PPA will not write tickets between 12 o'clock this afternoon and 12 o'clock tomorrow afternoon throughout the duration of that event, of that vaccine event. Some of those streets are posted. There's been some communication out both by Dr. Stanford Group and others to tell folks who are coming to the Temple Center for that event that they can park on those streets without fare of a ticket. So it just means that it will be an easing of enforcement in that area for the duration of this event.
So I think my concern is that when we're talking about the convention center as a mass vaccination site, I think my concern is that this would be, I'm assuming, a facility that would be operating ongoing and throughout various hours of the day. So how can we assure that the PPA is going to put us in a position where they're going to be able to relax those same, I guess, courtesies that you just talked about, Managing Director Alexander? How can we assure that they're going to have those same courtesies in that capacity, in that space, ongoing, so people can get, access to the vaccine?
Council member, I can't commit to that right now. I just could commit that that's the conversations we're having. Once we finalize those conversations, I don't mind whether it's one of our weekly calls or, whatever other form, sort of communicating back to council that has indeed taken place.
So I thank you. I appreciate that because I am concerned about that. I am concerned about the convention center as a mass vaccination site. I think in an ideal world that is not where I would pick. I think I'm born and raised in this city, and there's not many of things that I can think of that have happened that have invited people of color to the convention center. I think that most of the things that I've participated in at the convention center would have been something as an adult trying to maybe raise my professional profile. So I think that I understand from a geographical perspective some of the goals that's trying to be met. But again, I think with some of the perception issues we have, as well as some of the other issues that's been communicated today, I think we really need to have a collaborative effort and think through how we select sites and what provisions are in place to make sure that people are protected and people are safe. I know plenty of people who say, I'm not going to the convention center because you're going to boot my car. I'm not going anywhere around there. I'm not touching Center City because that's not a place that I would normally go throughout my travels and throughout my life. So while I get the intention of trying to be inclusive, I personally do not think that the convention center is the place where we hit the mark. Thank you, Madam Chair. I appreciate you, and thank you for everybody for being available to have this discussion and allow me to say my opinion.
Thank you, Councilman Thomas. I think you made an excellent point that I was making earlier as well, that, for a lot of our folks, they're in the neighborhoods. They're not coming downtown. They're just not going to do it. It's not, even though all bus lines, transit lines run there, it doesn't feel as accessible for a number of different reasons. So, but I think the idea of multiple points of access, the convention center, the link, in the neighborhoods, I want to emphasize in the neighborhoods, I think that those sites will go a long way towards making sure we reach our target population. I'm going to ask Councilwoman Gim to hold for 1 second because we have two other members who have questions who haven't had a first round yet, and that will be Councilman Squilla, followed by Councilman O. Councilman Squilla.
Thank you, Madam Chair. Appreciate that. And Dr. Farley, I know you had said that, now that the concern we're going to be is how do we get enough providers as we increase the number of vaccines. Is there a reason why that, when we give some of these vaccines, we're sort of limiting the number of people they could give the vaccines to? Like some of the pharmacies can only give it to 75 and over, and that's it. So therefore, they're having a harder time filling those slots with people who are looking to get the vaccines. Is that that restriction? Is that something we're looking to maybe limit so that 65 and over with medical issues can then be vaccinated at those sites?
Yeah, so with the pharmacy specifically, we were having a problem where their software couldn't, they don't have the information about whether people have medical conditions, and their software couldn't screen out people based on medical conditions. And so we wanted to give them a way to limit it to people who met our criteria. And an age criteria was something they could have some ability to enforce based upon their birth date. But, someone says, I've got diabetes, and basically anybody could sign up at a pharmacy. And we made it so that anybody could sign up at a pharmacy, then our people over the age of 75 would never get vaccinated because the younger people are much faster, much more aggressive. So we wanted to really have this period of time when the over 75s had a protected chance to get vaccinated. I'm hoping that that's pretty short, and then we'll open it up to other people who have medical conditions who would be younger when we get past that. We did, we're always trying to balance the fact that the people who are most vulnerable are the slowest to go in and sign up for these appointments. We're trying to protect those appointments to the most vulnerable folks.
Councilman Squilla? Oh, you're on mute, Councilman Squilla.
Oh, there you go. I'm sorry. I apologize. I was talking away there. So the challenge seems, though, that by delaying this and not all these folks are getting access, if the 75 and over takes them a while to get there, and so maybe prolongs it another 2 or 3 weeks, you're still eliminating some people who could get it, prioritize the 75 and over as they would get their appointments first, and then allow 65 with health conditions in there, because we know that, as you said, the issue is not going to be about the vaccines. It's going to be about the distribution of them. So why not start it now? It just seems like we're putting the restrictions in place to slow down that process. That's just my opinion. And so hopefully that's something that can change rather quickly. So thank you.
If I could just explain a little further, Council Member, because I understand the concern. You know that none of the pharmacies have an ability yet for us to send someone an invitation that can't be shared. So what happens is if we give an invitation to a 75-year-old and they pass it on to their son-in-law and he posts it on Facebook, then next thing you know, 500 people who are, age 25 to age 45 have signed up and taken up all the slots. At least if the pharmacies know we're not going to let anybody in who's under 75, then they protect those slots for those people. And that is what's happening. The pharmacies are going through and they're clearing out any appointments where people signed up are under 75. If we allow people who are under 75 to sign up, they'll take all those appointments. But the other thing is there are other opportunities for people to be vaccinated. It's not just pharmacies. So the hospitals are inviting people in now who have medical conditions who are younger than 75. The clinics are doing that. Dr. Stanford is doing that. So all these different are pieces of the overall network that we hope fit together.
All right, that just doesn't make a lot of sense in that folks that get an appointment with their name and they go to the pharmacy, if the pharmacy gets a whole bunch of people under 65 to register, they don't get an appointment. So that appointment, they could have all those people in that database, but they don't get an appointment. So you're saying that their databases aren't savvy enough to be able to pick, but they are savvy enough to pick by a date. When they send that appointment out to that person, there's no way to know for them what name has the appointment. Is that what you're saying?
So what we do is we take our database, our vaccine interest database, and we can pull from that people who meet eligibility criteria, and we can send to those people, here's a link that you can use to go to the pharmacy and set up an appointment. But people can take that link and they can forward it to somebody else, and those links have been forwarded routinely. And people who we didn't invite end up going in there making those appointments. And the a pharmacy, at least if they have a threshold, okay, anybody below the age of 75, we just cancel those appointments, then they can at least get the over 75s to get a chance. But if anybody at any age can make an appointment, then they'll all be filled up immediately by younger people.
They could fill out the application, but they wouldn't get an appointment because the pharmacy wouldn't give them an appointment because they're under 65 or they're under 75 or whatever. So I don't understand. Like you're saying, it's going to get filled up by people who are not eligible, yet the pharmacy controls who gets the appointment.
So it sounds like you're suggesting that we just lower the age range from 75 to 65. Is that what you're saying? Or are you saying that we should open up to people with medical conditions who are at any age?
I'm saying at least 65 and over should be at least granted the opportunity to be able to apply instead of saying you don't match that criteria. And then they would get an email from that pharmacy saying you have an appointment for March 24th at such and such a time, or you have an appointment at this location to get it. I mean, I don't think it's difficult. What we're doing is people are getting more and more upset and more weary that they are never going to be able to get this vaccine because we're limiting it to just a small few. And it's just causing more problems than I think solving.
Yeah. Well, just understand, everybody will have an opportunity to be vaccinated. Everybody will have an opportunity to be vaccinated. It's just a matter of time. And it's going along, about the pace that we expected would. This is going to take months. So I know people are frustrated, but we are trying to do this in a priority order, and the over 75s would be a higher priority than the under 75s.
Yeah, and the confusion caused by always having different rules from the rest of the counties and the Commonwealth causes that confusion too. And some of these people who get vaccines directly from, maybe FEMA or I think Rite Aid's getting them directly from the federal government. It just causes confusion by doing that, and I guess we're okay with it. But it's a concern for me.
Let me say that there's a patchwork across the country. Each state has done it somewhat differently. I would be fine if the federal government said these are the priority groupings. Everybody's got to follow that. That's not the way it rolled out. And I'm not so sure that if we did a system was just age-based, everybody over 65 was eligible, I don't know that would help our racial equity goals.
Well, I mean, with the racial equity is a question and a concern, but it's also, if you do 75 and over, I don't know how that helps our racial equity goals either. So, I mean, we can't say one thing without saying the other. The challenge is, if you're okay with the federal government giving guidelines and not changing them, why aren't you okay with the state giving guidelines, but you decide not to follow them?
Well, it's the state of Pennsylvania is different from the state of New Jersey, different from the state of Delaware, yeah,
but we don't live in those states. So, I mean, if you were okay with the federal government giving a whole national guideline, but you're not okay with following the state guidelines, I guess. All right. Well, listen, I'm going to let it go. It's just confusion just bothers me, and I think it causes problems for our residents in the city. So, thank you.
Thank you, Councilman. I think you hit the nail on the head. That there still is confusion even after we've we've moved beyond what happened at the convention center before with Philly fighting COVID. We're just trying to reassure citizens, but the process is still so very confusing that it leaves a lot of people with a lot of anxiety when it comes to trusting us that we know what we're doing, that we're getting it right, that we're putting out accurate information. And so it is of a great concern. So Councilman O was next.
Thank you very much, Chairwoman. I just had one point to follow up with the Managing Director, Tumar Alexander. And that was this discussion about parking. My question is that if there is going to be an effort to say between this hour and that hour, PPA is not going to enforce parking, but how do you know that the car parked in that spot is there to get vaccinated, as opposed to someone who parked there and went shopping, went to a restaurant or whatever? In other words, there are probably ways that you can, identify the vehicle as there to get vaccinated, but even someone who parked, got vaccinated, and then just left their car there to do some other things, is a typical problem that we've had. And so part of it is you're trying to move the traffic, the car, so they're not occupying space, so more people can come in, park, and, get vaccinated. What is your plan on that? Because I think it was a very good point raised by Councilmember Thomas, but I wasn't impressed with the answer that it was well thought out.
But Councilmember, I'm sorry you wasn't impressed. My apologies on that.
Not with you as an individual. I'm just saying I don't understand the planning around it, because that was in conjunction with the idea that somehow by not enforcing parking that there would be more people coming.
Yeah, I think so. I was attempting to both agree with the Councilmember Thomas, and let him know that we are working with Parking Authority as it relates to other mass vaccination sites, and certainly we'll do that with the convention center. What I wanted to express was a particular instance that we've done it with this ongoing Black Doctors Consortium event that's taking place right now. I think, I don't want to put a burden on the event organizers or anyone else to be able to, whether that's giving folks a card so they could put in a card to say, hey, I'm a part of this event. I think what we wanted to do was make it as convenient as possible for folks who may be driving to that event. Make it as easy as possible for those folks who may be driving to the event to park their car, not have to worry about a ticket, go stand in line, eventually get into the event, eventually get a vaccine, get back in their car. Now, I don't know what they do between point A and point B, but eventually get back in their car and move and allow others to do that. We want to just make it easier for access to those vaccine sites. I think I can talk a little bit more in detail with Parking Authority about what that looks like. I don't think we're going to be able to have a parking attendant or someone who are just monitoring, Tumar got out of his car and did he go into the Wendy's at Broad and Cecil B. Moore before he went into the vaccine site, or is he actually going into the vaccine site? We just want to make it easy for our citizens to be able to access this particular event and future events, quite frankly. Make sure that, they can get there by whatever method they can. So we could work through some of the details. I wanted to just sort of relate to Councilmember Thomas that we have done it at least in this one instance, and we are looking to work with Parking Authority to do it more in other instances, and especially when we start to get multiple mass vaccination sites or multiple community vaccination sites out and about, that we want to have that coordination to make it as easy and stress-free as possible for our citizens to go in and get vaccinated.
All right, thank you. And I guess the good and bad news is I saw a video 16 minutes ago. There's 1,000 people standing in line at the Leah Corus Center. So, the logistics to be worked through. Thank you very much.
Thanks, sir.
So thank you for that update, Councilman O. I have been monitoring that as well. And I sent one of my staffers down earlier today to, sort of check out the scene so we could see if we could get some folks, some of our senior citizens into the Leah Corus Center to get vaccinated. And I was told then that it was very, very busy. So, but again, the demand is high. I think, Dr. Farley, that is a perfect example of what we really need to think about, which is vaccinations in the neighborhood. I think that is just, I cannot underscore that enough. We just really need to be in those neighborhoods because that's where people feel most comfortable and that's where they're going to go. Councilwoman Gim had a follow-up question.
Yes. Thank you very much. Dr. Farley, what is the overall percentage of doses that have been given out by Philadelphia that have gone to Philadelphians versus outside the city?
I haven't seen it recently, but as of about a week ago, it's about 53% that went to Philadelphia residents. We have many that went to non-Philadelphia residents. That was in the beginning, as you know, we started with healthcare workers. Many of our healthcare workers lived outside the city. We're now including essential workers. Many of them live outside the city. We hope that percentage going to Philadelphia residents will rise, but it's too low from my perspective.
And then, do you know about whether are you tracking, for example, the hospitals? What percent of them have given it to Philadelphia residents versus the city residents? Philadelphia residents versus outside of the city.
I have not looked at that. I would say we'd want to look at it after they shifted from vaccinating staff to when they started vaccinating patients, because that was when they're vaccinating staff, they're vaccinating many non-Philadelphia residents. When they went to patients, they were told to vaccinate Philadelphia residents, not people from the counties.
And then for the city health department, the city health centers, what percent would you say are going to city residents versus out of Philadelphia?
I have not seen those numbers, but I would imagine it's very high as Philadelphia residents.
Yeah.
They generally serve their immediate neighborhoods.
Mm-hmm. So I think, this is, again, it just underscores the importance of the public reporting on zip codes by provider. I think it will help us. I understand the actual reporting is complicated, and I certainly don't expect you to send over zip codes with, loads and loads of it. But there needs to be some understanding of either high priority, the highest zip codes that are in receipt and the lowest zip codes, that they're getting, or something along those lines. But this question of, are vaccine doses going to barely half of Philadelphia residents? And look, I understand we're trying to change that, but I think it's one of the areas that will help us understand how to prioritize some of the providers. So dialysis centers, that we know serve high needs, vulnerable patients who are living in Philadelphia are, perhaps as important, to track as the large hospitals as well. But really just feel very strongly about this issue of the zip codes, whether I know it's not in the bill, but either way, we need to be tracking it. It's my preference that we actually legislate some of it if we can, but. I think
I want to
Mr.
recognize
Engler?
it for a point of information, Jim Engler. Jim?
Thank you, Chairwoman. I just wanted to mention that we have been in very close coordination with our federal delegation about our vaccine allotment to increase our vaccine allotment on a weekly basis based off of that very point that we did at the beginning of this, vaccinate a number of non-residents. Congressman Boyle, Congressman Evans, and Congresswoman Scanlon did send a letter to the CDC last week arguing for an increased allotment for metropolitan areas like Philadelphia. We've also had conversations with other direct dose cities, including New York and Chicago, about advocating as a group for additional vaccine doses to come to the city based off of the fact that we are vaccinating a number of non-residents. So we're going to continue to push that and appreciate council members joining that effort as well.
Yep. My only issue is we don't know what we don't know. So if we don't know if we're not actually getting the public reporting by zip code, we don't actually know which providers are serving Philadelphians and which are not. And so that's why I feel very strongly that it may be a laborious reporting thing, but I think it's really important. I think it's key to helping us understand things and to be able to track the equity issues and the allotments. And I think you're basically already doing some of this, but you just need to provide a filter by provider so we know who we should be prioritizing as we get the doses out. But 53% of our doses are, as of last week, as of recently, and we want to see that change. But we're a number of months in. We have to figure out how to change that, but I don't think we do it if we don't know what we're tracking. We don't actually know where the vaccines are going within the zip codes. We know they're going in certain places, and I'm sure you're tracking it overall, but we really do need to be tracking it by zip code, and it should be publicly reported, and we should be holding our providers accountable, or at least knowing whether and which providers are doing the best job at covering our Philadelphia residents.
Understood. And I think Dr. Farley mentioned around the first set of questions that we'll look at the best way to present that data and include it as part of our regular reporting to council.
Thank you.
Okay, Councilwoman Kim, are you good?
Yes, thank you.
Okay, very good. All right. That being said, are there any other questions or comments from members of the committee? And I don't see any. There being no further questions from members of the committee and no other witnesses to testify, I'll ask if there's anyone else present in the hearing whose name we have failed to call and that wishes to offer testimony on any of the bills being considered, on the bill being considered today. Okay, and hearing none, I want to thank all the panel and one witness for your participation today. We value your opinion, and I now invite you and all others who gave testimony and information to please disconnect from the meeting so we can go into our public meeting. We will now pause for the proceedings briefly, and as multiple participants leave the hearing. So thank you again for being here for your testimony. Have a great weekend. Okay. This concludes the public hearing of the committee. We will now go into a public meeting to consider the action to be taken on the bill before this committee today. Madam Clerk, will you please call the roll to take attendance? Members that are in attendance will please indicate that you are here by saying present when your name is called. Also, please say a few brief remarks when responding so that your image will be displayed on screen when you speak. Madam Clerk?
Councilmember Heenan.
Councilman Heenan is present, and I'm going to thank Madam Chair for another outstanding job over, extremely important and critical issues to our health and safety of our city. Thank you.
Thank you, Councilman.
Councilmember O.
Madam Chair, I am still present, and ditto what Councilmember Heenan said.
Thank you too.
Councilmember Gimm.
Madam Chair, I am present. Thank you.
Thank you.
Councilmember Green.
Madam Chair, I am present. I'm gonna have to start calling these Public Health Fridays.
Yes, we have a theme going here.
Yes, but we're getting good information on Fridays, which is good.
Absolutely. Thank you, Councilman.
Mm-hmm.
Councilmember Thomas.
Present.
Thank you.
Councilmember Brooks.
Present. Thank you.
And Chair Bass.
I am present. Okay. Thank you. A quorum of members is present. This is the public meeting to amend Bill number 210082. The chair recognizes Councilmember Heenan for a motion on the amendment to Bill number 210082.
Thank you, Madam Chair. I make a motion, move that the amendment to Bill number 210082 be reported out of committee with a favorable recommendation with the rule suspension as to be heard at our next session of City Council.
Second.
I want to note for the record that Councilman David O has seconded the motion. Councilman, did you have I'm sorry, you're raising your hand?
Yes.
Yes, okay.
I did want to ask the question earlier about the possibility of including zip codes in the bill, and just to have a discussion about whether that, we heard a little bit, I think, today about the importance of not what we are not really keeping close. I mean, I think the health department is keeping track, but it is concerning that only half of the doses are going out to Philadelphians. So I'm just trying to understand whether we're
right. Well, Councilwoman Gill, right now we have a bill. We have an amendment on the floor. It's been seconded and calls for a vote. And so we could certainly have this conversation and with the full body of council. So that's what I would recommend at this point.
That's fine.
Okay. Thank you, Councilwoman. So it's been moved and properly seconded that the amendment to Bill number 210082 be approved. All of those in favor of the motion will signify by saying aye.
Aye.
Is there anyone opposed? The ayes have it. The motion carries, and the amendment to Bill number 210082 has been approved. The chair recognizes Councilmember Heenan for a motion on Bill number 210082 as amended.
Thank you, Madam Chair. I move that Bill number 210082 as amended be reported out of committee with a favorable recommendation with the rule suspension as to be heard at our next session of council.
Second.
Hold it.
Councilwoman,
this is John.
yes, Mr. Christmas, did you have a point?
Yes, ma'am.
Of information? Yes.
Yes, ma'am. Yes. The bill has to be, there's a motion to amend the bill. That needs to be voted. And then there's a second motion.
Yes.
To the bill out as amended.
Is that what we did? We didn't do that?
It sounds like you called for a motion on the amendment, and Councilman Heenan went ahead and reported, said, I
okay.
Vote to, bill out.
Mr. Christmas, maybe let me start over. All right. Maybe I was technically incorrect on the first motion. So let me go back.
Point of information. Councilmember Heenan did amend the bill. You may need to make a motion to vote the bill out as amended.
Right. That's what I believe the language was. Why don't we start?
I think the confusion, if I may, Madam Chair, I made a motion for the amendment, but I added the suspension of rules to be heard at the next session of council, which was technically incorrect. So it should have been just a motion without the rule suspension. But we did vote on the amendment, and then we subsequently on the second motion also voted it out, with the rule suspension as amended. So if the parliamentarian wishes, and Madam Chair, I will go back on just the motion to amend and then go through the process again if that is if that's technically sound, or is it okay as motioned and approved as amended?
Well, Mr. Christmas, correct me if I'm wrong. What I would like to do is go back to the public meeting and report bill number 210082 as amended, because we did do the amendment. So can we proceed from that point forward?
Right. If there was a right, because I might have missed part. If you've already, the motion to amend has been adopted.
That's correct.
It is right to be moved out of committee with a favorable recommendation as amended.
Which we just did, Mr. Christmas.
Okay, well, I'm just answering the council lady's question. Please.
Okay. So, all right. So let's start from here. The chair recognizes Councilman Heenan for a motion on bill number 210082 as amended.
Thank you, Madam Chair. I'd like to make a motion on bill number 210082 as amended. Be reported out of committee with a favorable recommendation with the rule suspension as to be heard at our next session of council.
Second.
And for the record, I want to note that Councilman O seconded the motion. It's been moved and properly seconded that bill number 210082 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All of those in favor of the motion will signify by saying aye. Aye.
Aye.
Any opposed? Okay, the ayes have it and the motion carries. And that concludes the business of this hearing. I want to thank everyone for being in attendance today. This concludes the business before the Committee on Public Health and Human Services. And we thank you all very much for your attendance. Thank you.
Thank you.
Thank you.